Hi everyone, this is Barb Collura with Resolve, the National Infertility Association. Welcome to our kitchen table conversation. This is a conversation which is really hearkening back to our founder, Barbara Eck, who started Resolve around her kitchen table in 1974. So around our table, we like to bring experts together, we like to hear the patient voice, and we like to have these important conversations around issues and topics that matter to you. I want to also thank our kitchen table conversation sponsor, Granada Bio, for their support of Resolve and our kitchen table conversation series. So today, we're going to talk about the impact of infertility on women physicians. I think this is going to be helpful for a lot of people when we think about a particular field, in this case, a medicine, but really, how do you advocate? How do you navigate a workplace? And how can your professional organization and really joining together in community help you and help people on their family building journey? So I'm really excited to share this table with two good friends, Dr. Eliza Chin and Dr. Erica Kaye. I'm going to ask both of you to introduce yourselves in a minute, but what really prompted a lot of this attention was a journal article published in Academic Medicine that looked at the prevalence of infertility amongst women physicians. In this case, the data showed it was 1 in 4 women physicians have infertility, and that was shocking for a lot of reasons, but it also was a much higher prevalence than the data at the time amongst the general population. And so we want to talk about this topic, and we want to talk about what you can do potentially in your workplace, whatever your profession is, and how you can make change happen. So I am going to ask both of you to introduce yourself. I'm going to start with you, Dr. Kaye. Tell us a little bit about yourself and what brings you here today.
Thank you so much. So my name is Erica, and I am a pediatric oncologist and hospice and palliative medicine physician and researcher. And I became intimately and acutely cognizant of issues related to infertility for women in science and medicine through my own personal journey with infertility, which lasted more than a decade. And I had a lot of firsthand experiences with fertility diagnostics and treatment. And our family has experience with IVF, open adoption, and use of a gestational carrier for surrogacy. And I had the opportunity to learn extensively through my own personal experiences, and then serve as a resource and mentor to other women in my profession struggling with similar issues. And as we tried to advocate for better awareness of the issue and for increased coverage for fertility treatments, I became increasingly aware of the significant issue of deficits in coverage across all of healthcare, and how our healthcare sector is in this regard behind other sectors like business, tech, industry. And so I authored a call to action in the New England Journal of Medicine advocating for increased awareness and discussion around strategies to improve coverage for fertility treatment. And that article was very helpful in specific advocacy work, as well as furthering conversations on a national platform for the need for improving access to care.
Yeah, we're going to talk a little bit about that journal article. And I just want to say, and thank you for being brave and not only sharing your story, what a incredible thing to do to publish a journal article like that, and be so so transparent and real in your own journey, but you said it, you've been a mentor and a fierce advocate, and we thank you for that. And we are so honored to have you here because it's really the power of a person, but also the impact you've had both on your workplace and others that we want to hear a little bit more about. So inspiring. So Dr. Chin, if you want to introduce yourself.
Thank you so much, Barb. I'm Eliza, sorry, lost my voice there. I'm Executive Director of the American Medical Women's Association, internal medicine by training. We got involved in this work also related to the publications that had come out, the call to action paper in academic medicine, as well as the data that preceded that, published in the Journal of Women's Health, and also Dr. Kaye's piece in the New England Journal of Medicine. And really, it was the statistics of the fact that 1 in 4 women physicians experienced infertility that really kind of got us thinking we need to do something in this area if this is affecting 25% of our members. So one, increasing awareness, because I don't think everyone was aware of those statistics. Certainly, leadership in medicine, we felt that people needed to understand some of the experiences that women physicians were facing, and also the challenge of access to care related to fertility, barriers related to it because of perhaps financial considerations, insurance coverage. Doctors spend their critical, probably their most fertile years in medical training, which can be very rigorous. It can also be a time when people have loans to repay and don't have the financial resources to seek opportunities. And so we felt that we needed to be a voice of advocacy, and we're thankful to partner with Resolve to take the Coverage at Work toolkit and create language that would be useful for physicians. And Dr. Kaye was so incredibly helpful with that in her own advocacy to help us come up with the data, the statistics that were needed to get the attention of leadership in healthcare. And since that time, we've continued to advocate for coverage at work, but also just for general awareness of physicians coming into the field, trainees, to think about these issues, to think about what does it mean to have a reproductive life plan, or what is your reproductive identity? Those are some of the themes and the concepts that some of our members and leaders are working to develop.
So here you are, you're a professional organization. I know the organization has been around for what, 75 years or something, like a very long time?
This is our 108th year.
Okay, 108th year. And I'm sure people would think as a professional society, for women physicians, you're looking at a number of things to support your members. And I'm thinking, wow, you just went to something very personal, very real for your members. And you said it, you thought, gosh, if 25% of our members are going through this, how can we better support them? So I just really quickly, I love professional societies. I think they're an amazing, I tell anybody, join whatever professional society it is for your field. Do you think other professional societies should look at things like this? Because infertility seems very private and very personal, and yet you all are doing such a great job embracing this. Was there ever a conversation at the association about that piece of it?
Well, that's a great question. And I think what you have said in some ways captures what AMWA is all about. We are very agile. We're very forward thinking. We, in many areas of medicine, were first to support an idea or concept that most of the medical associations weren't ready to embrace, whether that was, contraception, reproductive health care, even women's health. And so I think, we realized that this was a need for our members, and at the heart of our mission is to advance women in medicine. And we really felt that we could not do a good job of that without addressing such an important issue. And so the first summit that we held, the first Physician Fertility Summit, which both of you, so gracious, grateful to you all for speaking at the summit, was kind of just to put it on the map for everybody else. And that was the goal, to say this is something that we should all talk about, not just AMWA in particular, but, you know, given the fact that women are entering the medical profession at just more than 50%, this is a relevant issue for a growing number of our healthcare practitioners. Because we were nimble and quick, we were able to pivot and really dive in, and fortunately met some wonderful leaders to help us on this journey.
Well, and I know, Dr. Kaye, you were a big part of that.
Barbara, I would add to that this issue is not unique to any one specialty or field within healthcare. It's deeply and intrinsically cross-cutting. And so an approach by necessity should be transversal, right? So I would encourage and applaud any specialty-specific organization who wish to increase awareness on this topic and recognize that there's a need for umbrella organizations that have the ability to raise awareness and implement action on a transversal scale for them to be leaders at the forefront of this movement. And the other piece that I would add is, as was already mentioned, this is an issue that affects men and women across ages and across stages in the healthcare training life cycle and career beyond. And it most directly impacts those men and women earlier in their training, because that coincides with peak fertility years. And so I do think there is an opportunity for transversal work to agree at the level of graduate medical education. So specifically medical schools, and then residency programs and fellowship programs. And there are organizing entities that bring together program leadership in graduate medical education. And I think that is a place where both AMWA and Resolve and others could partner and target, so that there is more action-oriented work occurring within that program level, reaching the greatest proportion of affected individuals.
Wow, thank you for that. And there's a call to action right there, right? Some work that needs to be done. Dr. Kaye, I know that you've been so open about your infertility journey. Just on a personal level, you know, when you were you know, in the throes of it, and you're trying to advance at the same time your professional career, how did you get support? How did you take care of yourself?
That's a wonderful question, and I will not hold myself up as a poster child in my
we all had
response.
our moments, yeah.
So I did, in retrospect, an exceedingly poor job of seeking support and practicing self-care during that time. So I began pursuing fertility treatments during my pediatrics residency. And there was a lot of shame and secrecy around that process for me, which I didn't unpack at the time. I'm not sure I was even cognizant of it above surface level. I think, though, looking back, I felt deeply embarrassed that this natural function that my body should do, it didn't. And I was exhausted and overwhelmed in an incredibly rigorous and strenuous training program. So I think I didn't feel like I deserved to have support. I didn't really feel empowered to share my experiences with others, and I was embarrassed. And I think we're taught in medicine, and we internalize these subconscious lessons to be healers first, and to think about the suffering of our patients and their families. And as I pursued my training, my specialty is at the intersection of serious childhood illness and end of life. And so when I looked at the grief and suffering of the patients and the families, it was very easy for me to feel like my grief was insubstantial. that I didn't have a right to create space for my own personal sorrow. And, it wasn't until I was many years into the experience and began to be approached by other individuals who were struggling, who viewed me as a mentor and someone they trusted, and were confiding in me their struggles and experiences, that I began to realize how much wisdom I had accrued and how much I had learned about myself through the process. And I was very amazed to realize the catharsis inherent to verbalizing my story and leveraging it as a form of tool for helping others grow resilience and helping others advocate for themselves and helping others find self-care. And so transforming what had been a very painful, difficult season in my life into an agent for positive change was very meaningful and cathartic for me. And I realized in doing so how much power and self-care there was in transparency and leaning into vulnerability.
Oh, wow.
And so I now tell all of our trainees and students and encourage them to the best of their ability and to push themselves to that border of discomfort, to lean into their vulnerability, because often you'll be surprised at how healing that is.
When hearing your personal story, which thank you for that and for your vulnerability and honesty, because we can all say, oh, I did great. We have at Resolve, we do advocacy day, we do advocacy activities, we do state advocacy days, and always people come away from that experience and say, I feel so like this helped me.
Yeah.
I feel so like I feel better. I feel empowered. And I know we throw that word around, empowered, but it really is. It's true. It's what you said it when you started talking about it and verbalizing, and then actually started helping others. It from a mental health perspective helped you, and it's just so powerful. So I want to just take the last few minutes of this to really focus on what AMWA has done, and Dr. Kaye, what you have done. I don't know who inspired who, but I feel like you both are just coming together on this area of the lack of coverage in the workplace. And I love that you both have said that's not acceptable. That's not right. And I also love, Dr. Kaye, how you said, gee, you look at these other sectors and they're leading in how they're taking care of their employees. What's wrong with healthcare? So let's talk a little bit about it. Either one of you jump in, because you both have organizationally and individually have recognized this gap, which is lack of insurance coverage for medical treatment and other family building. And Dr. Kaye, maybe you start, or Dr. Chin, you start. Why is that something you have focused on, and how have you gone about doing that?
I think about it from two perspectives. The first is humanism. It's important because it's the right thing to do. We need to support the health and wellness of all individuals, and in particular for our healthcare workers who come together as healers, who are dedicating their lives, their careers. Their passion is supporting the health and wellness of others. We need to ensure that their health and wellness is also adequately covered. I also think there's a pragmatic reason as well. It's good business sense. It's good for recruiting. It's good for retention. It's good for organizational growth. Investing in your employees and their health and wellness will always reap positive dividends for an organization. And I think other businesses have effectively demonstrated why that strategy is productive and where the return on investment is. And as you mentioned, healthcare has been a little bit behind the curve. But I'm hopeful that there is increasing awareness. And I see now with effective strategies and individuals within organizations taking the initiative to bring this salient information to their hospital or organizational, institutional leadership and to their HR, and advocating can truly move the needle, both at that institution level, and then that has butterfly effect, positive impact on other healthcare organizations in the region. And I'll pass the baton to Eliza to talk about the toolkit that people can use to affect this change.
Yeah, thank you so much, Erica, and thanks for all your help with the toolkit and the messaging and knowing kind of what worked in your situation to help us translate it to a broader audience. And I would agree with everything you said. And I would also just highlight something that you said earlier. You know, as healthcare practitioners, we're so ingrained in us to take care of our patients. Self-care is just not talked about enough in medicine. Now with the whole burnout issue, I think it's getting more awareness. But then in particular, I think the struggles with infertility were often in silence, even in your case, until you later on were able to use that in advocacy. And so I think what we'd like to do is give people the space to share those stories that will inspire others to also help advocate. So it's not just those who are walking the fertility journey are out there kind of doing the advocacy. We really need everyone involved. And that's why the toolkit can be so helpful, because it's for everyone to send a letter to a department chair, to write a letter to HR, to ask HR. And the more and more people asking the question, hopefully it can be recognized that this is something we should be doing in healthcare to take care of our own, just as other sectors are doing for their employees. And with physicians, as physicians help advocate, the ripple effect also will go to all of the other employees working within a healthcare system who may not have the same voice or advocacy within the healthcare system to do so. And that's really going to, again, improve healthcare for all.
It's wonderful because it's the professional organization, again, AMWA, saying we have all the resources. Guess what? We've used experts, i.e. people like Dr. Kaye, to help us design this. You have the mentorship, you have the community, you have all the tools now, and let's make this happen. So Dr. Kaye, if you can, in just a minute or two, because people might be looking at you, you're so persuasive, you're so well spoken, you are so passionate about this. I am sure you walked right into HR, you had one conversation, and you got all the benefits right then and there, and you were skipped out of there. Isn't that how your story went?
It did not.
It did not. Shocker. So what's your message? What's your take-home message for people? Because wow, people look at you and say, my goodness, if you couldn't get this done, how am I going to get this done?
So I think first and foremost,
and you did get it done, by the way. But not that first conversation.
Patience and perseverance. And I want to open by saying I did not do anything on my own. There were a number of individuals at my institution who felt strongly about the need for improving access to fertility coverage, and we organized. And that didn't require hardly any effort. It required no resources. It was just a little bit of communication and strategy. So in annual reviews, saying to each other, reminding everyone, please put in information about how you personally feel like it's important for there to be fertility coverage. There's at least one touch point every year where institutions ask for feedback. So use those touch points. Anytime there's a town hall or community gathering, for those who are willing, stand up at the microphone and say out loud, this is important to me. And you'd be surprised how a few voices together, as small as a dozen or so, can translate into what feels like a large volume to the people who are listening, because they know that for every one person who speaks out, there's probably 100 or more who are not speaking.
Wow. Yeah.
And when we then got everybody together and in a concerted effort said, in this 1 week period, send your letters to HR. And I put together a brief template and said, change this however you want, but if you don't want to change it or you don't have the bandwidth, send the letter as is. And so in a short period of time, HR received a lot of personal stories about why this was important. And then I think what really helped move the needle is being able to point to the literature, because those in leadership in medicine, in healthcare, are very smart, evidence-based individuals. And so being able to point to credible journals, including the New England Journal, which has a lot of prestige, and saying, look, they felt like this was really important to publish, and this consolidates in a couple of pages the arguments for why our healthcare institution should be pursuing this. That constellation allowed us in a relatively short period of time, on the order of a couple of years, to move the needle for seismic change at the institution level, allowing comprehensive coverage for fertility treatments from having no coverage. And I really believe that this is possible at any organization, but it requires a little bit of coordination, patience, because it doesn't happen in weeks or months. It's often over many months or sometimes years, and a lot of vulnerability.
Well, and Dr. Chin, this is what AMWA is trying to do. You're trying to provide all of those tools and resources, that support network and that training, so that you can take all of this wisdom. Where do you go next? What's your vision for your fertility program and work that you're doing at AMWA?
So I think Dr. Kaye mentioned data, and I think that is so important. So we've got some teams within AMWA doing some research studies, because data speaks stronger than anything else. I think the stories are always important, and having more opportunities for storytelling and sharing those stories are incredibly important. We are going to be hosting a second Physician Fertility Summit, hoping to bring together, more medical organizations, again, to raise awareness of this. And at the end of the day, I would agree with Erica, voices matter. Each voice matters. Voices together, becoming one advocacy voice makes a huge difference. And ultimately, this is about, even changing the culture of healthcare. Hopefully years from now, we'll look back and Barb, it will be, the standard will be for most healthcare systems to have coverage. Wouldn't that be great? But it takes time to do that. It takes time to change the culture, but it's all about speaking up, sharing stories, generating the data that's needed, and advocating for change. And so we hope to be a big part of that revolution.
Fantastic. Well, I would be remiss if I didn't mention that Resolve gave our Hope Award for advocacy to AMWA for all the work that you all have done. And Erica, your institution where you work received our Hope Award for Access for the work that they've done in providing outstanding benefits to their employees. And of course, a big nod to you and your leadership in making that happen. So last question for both of you. You have an opportunity to give some advice to someone who's just entering medical school, and they're probably not thinking about their future fertility, but what is some advice that you would give to them? And I would assume that if you are not pursuing medical school, but maybe you're going to some other kind of postgraduate field, science, law, business, you're going to be at it for a while. And so what's that piece of advice that you would give?
So I maybe have two pieces of advice that are related closely with one another. The first is that every individual is unique. Every context, every situation is unique. And so there's no right way to do any of this. And there's no right time to grow a family. And you'll hear iteratively across your training that now is not a good time. Med school is not a good time. Residency is not a good time. Fellowship's not a good time. Junior faculty is not a good time. The truth is, medicine is busy and fast-paced. And there will never be a good time to pause and prioritize other things above your career. And you get to choose when is the right time for you. And so to tune out those voices as much as you can and make choices that align with your values and your goals, that are not being externally driven by other people or sort of society's expectations. Within that, I think that it's imperative to be informed. So knowledge is power. And so that doesn't mean that I'm telling all medical students to go out and freeze their eggs, right? Because it's very, very context specific. Not everybody wants to have children. First of all, not everybody is ready to think about that. You might be waiting to meet your partner. And there are a lot of other reasons why now might not be the right time aligned with your values. And it is never too early to be informed. And so learn about what it means to be infertile, learn about the statistics, sort of the way that you would inform yourself about other risk factors that directly affect your potential future health and wellness, and learn about the process. Because I think one of the biggest roadblocks that paralyze people is how overwhelming and complex the process seems. But if you unpack it bit by bit, familiarize yourself with these mechanisms, what the jargon means, what the different options are at a time that's lower stress, when you're learning that information purely to advance your knowledge, not under some pressure cooker, it becomes much less intimidating and overwhelming downstream. And so I encourage people to ask questions, to discuss openly risks of fertility, talk about it with your doctor, talk about it with your peers, with trusted mentors and teachers, and educate yourself on fertility preservation and fertility treatments.
Wow, great advice. Dr. Chin, what's that advice that you would give? Anything different?
So I'm not sure I have too much more to add to that, but I would echo a couple of things that Erica said about really knowing yourself and what you want and what your values are, and not feeling like you have to do what other people do because that's the right way, whether that is egg freezing or some other option, and to be okay if that's not a path you even want to go down at all. And I think, being open to possibilities, knowing that your feelings might change, being open to change when that happens. There's no right or wrong decision, and the decisions may change over time. Also, I would just add, don't be afraid to be practical about things, and ask the questions that you need to kind of find the answers for some of those practical decisions, whether that's financial resources or coverage or time off. Don't be afraid to ask for those and have those discussions. So otherwise, I think Dr. Kaye pretty much said about everything else I was going to say.
Fantastic.
Thank you for that.
Both of you, that was really great. I so appreciate you both taking the time to share your wisdom and your experience and continue these conversations. And Dr. Chin, the AMWA website, how do people find AMWA?
So it's amwa-doc.org. And if you go under what we do, you'll find information about our physician fertility initiative. And we should have information soon about the next summit.
Fantastic. Thank you so much, both of you, for sharing, again, your wisdom and your stories, and just inspiring all of us to realize that nothing is insurmountable. You both have really shown that. So you both, and thank you for listening to Resolve's Kitchen Table Conversation.